name's Harlan Soblisky. Today for Lab 1 we're going to be doing pre-screening and risk stratification for an exercise program and evaluation. Across from me here is my client, Mr. Kidd. He's going to be filling out some forms for me, going over consent and medical history and a PARQ. So if you don't mind filling out these forms. The reason I'm having him do these for the informed consent is going to explain the purpose of these tests, why he needs to go through them, the benefits of them. It's also going to describe some of the procedures. Going to let him know what's going on, keep him informed. It's going to let him know the risks and discomforts. Some of the tests we do, such as the skin folds, kind of require some pinching and touching. It's going to describe his responsibilities, what I expect of him, what he can expect from me. And I'd also encourage him to ask questions and let him know that this is all confidential and that he can withdraw at any time. The health history, this is just going to help me do his risk stratification, let me know what category he falls into. It's going to let me know any past or present diseases, illness, or medication he's taking. It's also going to let me know his family history and his exercise history. The PARQ is just going to do a small measurement of his readiness to start a program. It's also going to give me some more information medically, if he's had some chest pains, discomforts, or wheezing, something wrong with his pulmonary system. It's going to let me know all that. So, okay. Do you have any questions or anything about any of the forms? Do you understand everything?
I believe I do.
Okay. All right. So next we're just going to go over some risk stratification, just like the other forms. This is just going to help me figure out how to evaluate you, what you may need in terms of testing, and then it's going to help me figure out your actual program making of it. Okay, so first, you're a young man, much less than 45 years old, so we don't have to worry about that. Now, like I said, the form earlier is going to tell me, but I'm going to go ahead and ask him just to go through it. But for family history, have anyone in your immediate family, meaning your mom or your dad or your brothers, your siblings, have a heart attack? For males, it would be before the age of 55, or females before the age of 65.
No.
All right. Are you a current smoker or have smoked within the last 6 months?
No.
All right. Have you been participating in moderate physical activity at least 3 days a week for 3 months?
Yes.
Okay. According to the form we filled out, your body mass is below 30 kilograms per meter squared, which basically means that you're not obese, and your waist is less than 102 centimeters. So you don't have to worry about that. So for your blood pressure, we're going to be taking your blood pressure here in a second, but just from the form, past blood pressure taken, you haven't had high blood pressure. It's always been 120/80. So again, there's no risk factor there. For dyslipidemia, which is basically high cholesterol, I don't really have a way to test that, and it wasn't specified in the form. So we're going to go ahead and mark that down as a risk factor simply because we don't know. And again, with the next pre-diabetes, again, I have no way of testing whether your resting glucose levels are high or low. So we're going to go ahead and mark that down as well. So you have 2 risk factors. And that basically just puts you in the moderate risk area, which basically means if you want to do a moderate or light vigorous activity program, you really don't need any further testing. Everything will be fine. But if you'd like to do a vigorous training program, I would highly suggest having a doctor and a doctor exam, a physical exam, and some more testing done. Okay. So obviously my client here is pretty healthy, but in case if I didn't know, I could do some more testing if I suspected that he had maybe some cardiovascular disease risk or some symptoms, or if I just needed some more information to help me make his program, we could do more testing.